Hello and welcome to Triage, rapid legal lessons for busy healthcare professionals, a podcast created and produced by K&L Gates. Each episode is designed to highlight important developments in health law and analyze the impact on our clients and friends of the firm. We hope you enjoy this podcast.
Hello, and welcome to this episode of Triage. My name is Victoria Hamscho, and I'm an associate in the firm's Washington, D.C. office, where my practice focuses on policy regulatory matters impacting healthcare providers, universities, and other stakeholders.
And I'm Rebecca Schaefer, a partner in the firm's Research Triangle Park office. My practice focuses on healthcare regulatory and transactional matters, with particular focus on supporting academic medical centers and universities, including their research programs. In this episode of Triage, we will explore some of the specific impacts that the COVID-19 pandemic has had on colleges and universities, and in particular, the disruptive effect to ongoing scientific research. We will also review some of the federal relief measures responsive to these impacts that have been implemented, proposed but not yet passed, and may be expected as the results of the 2020 election are finalized. This will all be through conversation with a senior research administrator at a major academic institution who has immediate and informed perspective about the disruption and cost of the pandemic to ongoing research, as well as the types of federal aid needed to preserve research programs and the pipeline of our next generation of researchers. To that end, I have the great pleasure of introducing our guest for this episode, Robin Cyr. Robin is the Vice Provost for Research Administration at Northeastern University in Boston, Massachusetts, where she has oversight of research compliance, grants and contracting, pre- and post-award administration, research-related finance, the IRB, and the IACUC. Northeastern has a rapidly growing research enterprise. Research expenditures at the institution have increased by 63% since 2016, which included an 11% increase in defense and security funding with the DoD, now representing 25% of the overall research portfolio. In addition to her role at Northeastern, Robin is also an active member of COGR, the Council on Governmental Relations, an association of research universities, affiliated medical centers, and independent research institutes that provides advocacy in the areas of research administration and compliance as it relates to federally funded research and graduate education. Robin, thank you so much for joining us today to shed light on this important topic.
Thank you for inviting me. I appreciate the opportunity to talk about the impact this pandemic has had on academic research.
Thank you. So, as you note, we have all felt the effects of the COVID-19 pandemic in our personal and professional lives. But you've had a somewhat unique set of challenges starting in your role at Northeastern right before the country first went on lockdown. What was it like starting in your role at Northeastern on March 2nd? And how have you and your team adapted to workflows and communications since?
It was actually surreal, I would have to say. I started at Northeastern on March 2nd, as you just mentioned, and I believe it was March 13th that the state of Massachusetts put out the notice that we were getting ready to shelter in place. New terminology to all of us, didn't really know quite what that meant. At that point, started talking to my staff, who I really didn't get much of an opportunity to get to know in the week that I worked with them, but started talking to them about what will you need to work remotely. We don't know how long you're going to be needing to work remotely, but let's think about the things that are in your offices and your workspaces that you might need to take home so that you can work remotely for maybe as long as 2 weeks. I then got on a plane on March 19th and flew back to North Carolina. Luckily, my new employer was gracious enough to let me fly back home to shelter in place with my husband. And I got on a plane on March 19th, naively leaving my car in Boston because I really thought, well, this is maybe going to be 2-3 weeks. I went back 5 months later.
That's amazing. And I'm sure you've had an equally amazing and impressively rapid shift of the entire research administration system that you oversee that was not already set up to work from home at the time all this came about. Of course, many aspects of laboratory and clinical trial-based research, by contrast, can't be performed remotely. I imagine shelter-in-place orders and continued social distancing measures have impacted lab access, travel for field work, clinical trial visits, and fundamentally, just the types of robust collaboration that is the bedrock of scientific research. What has it been like at Northeastern? What portions of the institution's research portfolio have been most impacted?
You know, it's funny, before the pandemic hit, I thought I was thinking about it the other day. The most disruptive thing that I had experienced in work was the government shutdown of 2013, where we all thought that the world had come to a screeching halt for 16 days because the government shut down. And in retrospect, that was so insignificant compared to what we're dealing with now. So figuring out how to wind down a research enterprise, because it wasn't just a project or a lab, it was the entire enterprise, was a big challenge. One of the first things that Northeastern did was convene a task force called the Research Continuity Task Force. And the members of that task force were all the associate deans for research, all the associate deans for finance. We had members from NU Security and the PD. We have people from EH&S and facilities. We have members that are dedicated to student affairs and student well-being, as well as people from the Office of General Counsel that are looking over the needs and rights of our employees. So we started sending equipment home to people. We started getting chemicals that might be unstable for a long period of time out of the lab. We started turning off equipment, not knowing if we would be able to start it again. When we did start doing spin up again, not knowing what kinds of purchases we would need to get things going again, and we literally shut it down. The only people in the research realm that were allowed to go back to campus and were deemed essential personnel were our animal care technicians. And that was a really tough position for them because everyone else was hunkered down at home. No one was on the streets. There was no one on the T or mass transit. So they were going in all by themselves every day to take care of our animals. And they did an amazing job of that. But everything else literally shut down. So clinical trials, we couldn't bring people in to the university. We didn't have staff even or researchers on campus. And field research where we would go into people's homes and do interventions and care, even surveys, everything came to a screeching halt.
Has Northeastern relied on any of the COVID-19 related flexibilities in its response? For example, there was an April guidance from OHARP about actions that do and don't require IRB approval. There was an NIH guidance supporting virtual study visits and extensions on budget and reporting periods. I don't know if telehealth and state licensure flexibilities have been relevant for you, but are there any of the sort of regulatory solutions that have been made available that Northeastern's relied on?
We did take advantage of the OMB memos that came out, giving us idle time flexibility, if you will. So very early in the pandemic, the Research Continuity Task Force developed a survey that we sent out to all of our research faculty, asking them what this impact was going to be like for them. Did they have any work that they could do remotely? What could they do? Could they still mentor their students virtually? And we started to determine what pieces of research could continue. Anybody who was at data analysis phase or still doing collaborations virtually, that could continue. It was mainly the research that was in the labs or out in the field that we had to really wind down and pretty much stop.
What have been some of Northeastern's biggest costs in responding to the COVID-19 pandemic to try to enable, once you were spinning back up, and costs associated with supporting the ongoing research at the institution?
Well, the biggest cost for Northeastern was we spun up very quickly a CLIA-certified testing facility. So Northeastern has now conducted over 400,000 COVID-19 tests. We use the anterior nasal swab test, so the gold standard. Students are tested every 3 days. Faculty and staff that are going to campus are tested every 2 days. And right now, out of the 400,000 tests that we've run, we have 274 positives. So our positive rate is very, very low. But we think that's in large part because we're testing so frequently that as soon as someone is identified as a positive, we immediately reach out to them, start contact tracing, we isolate and put people in quarantine, and we start to limit the possibility of any kind of a spread. Doing that testing facility and doing the testing as frequently as Northeastern is very effective, but as of this week, we've spent about $100 million spinning up the testing facility, buying the reagents, staffing it. We've had to bring in at least 40 technicians that are working in the lab. We also have seen a bio waste disposal cost increase of 168%. The respirator program, because everybody who's working in our testing facility has to wear a respirator, that has seen a 3,000% increase. And these are unbudgeted, unanticipated costs. We had to hire a temporary contractor to do respiratory fit tests, and that's a 4,500% increase in cost. And our lab coat program, we had lab coats like most other labs that you go into the lab, you take a coat off of a rack and you put it on. And when you leave, you put it back on a hook or a rack and you just grab coats. Now we have to have lab coats for everyone. They have to be washed after each use and handled much differently than they were before. So our lab coat program saw an increase of 168%. So these are costs that no one could have anticipated, and there's no real way for us to get reimbursed for them that we're aware of right now. That's just the cost of the testing facility. Other costs that we've incurred are recalibrating equipment, reconfiguring lab space. So we've got signs, we've got stickers on the floor, we've repurposed and moved furniture out so that there's no possibility of people dragging a chair or dragging a table close together. So we've done everything that we could to have the environment when we started spinning back up and bringing people back in, structured so that they would have a healthy, safe distance, wouldn't have to really worry about it that much. Spent a lot of money on PPE and a lot on education and just making sure that people know if it's a day that you're going to go to campus, step one is you have to do your daily wellness checker. If you have any symptoms and you don't get a green check on your wellness checker, you actually can't go to campus. You can't even go to the testing facilities without a green check on your smartphone. So when you get to the testing facility or you go to classes that are being held in person or you want to go to a lab, you have to have your cell phone with you and you have to be able to show your green wellness checker with the date and time stamp for that day. If you have any symptoms whatsoever, you have to go to one of the two testing facilities. We have one for people who aren't experiencing any symptoms, and then we have another testing facility in a more discreet location where people would go to if they have any kind of symptoms.
Those are just staggering costs. That's incredible. So other than the obvious budgetary impacts, as you've described, these were unbudgeted expenses. Other than those impacts for the university and the ongoing disruption to continued research at the institution, what are you most worried about in terms of COVID-19 impacts on your program, on your faculty, on your learners, on your research community?
We've heard a lot specifically from our female faculty that feel extremely disadvantaged and are very concerned about their ability to progress in their research fields. A lot of these women have small children at home, and now that they've got the task of keeping children on tasks for remote learning, and the kids are home or they may have elder care responsibilities, our female faculty members have expressed very serious concern about being held back, about missing opportunities to collaborate. They feel like they're getting set back on publications because they just don't have the ability to run their home, keep their family safe, and still focus on career development and publications and writing grants and doing their science. So we worry a lot about our female faculty members. To be fair, I have to say that I've also heard from a number of male faculty members with the exact same problems. Their wife may have a full-time job and they too are sharing the responsibility of supporting their children and making sure that they remain engaged with remote learning, or they're sharing the responsibilities for elder care. So they also feel like they're at a disadvantage and they're concerned about their ability to go forward and increase their research productivity. We're also worried a lot about a term that I find particularly offensive that started cropping up in the last couple of months, COVID postdocs or COVID graduates. And we're concerned about the perceived stigma of, well, if you got your degree during the pandemic, you probably didn't have as rigorous a curriculum or educational experience as you would have had there not been a pandemic, and there wouldn't have been any kind of disruption in your education and your research endeavors. So that's very concerning because actually I think that it's kind of the opposite. What I'm hearing and what I'm seeing is people are working pretty continuously now. Since most of us are working remotely and our offices are now in our home, there really isn't a good separation between work and home life because you're there all the time. I know myself, I can't really walk by the room that my computer and all the monitors are set up in. If I see something just came in and the screen lights up, I'm compelled to go check it. And I'm hearing that across the board from my staff, from research staff, and from students. We're all just connected constantly.
Well, it sounds like you're very in tune with your staff, with the faculty, with the issues facing the research community at Northeastern. And you've also reviewed some of the measures that the institution has taken to respond. But what relief at a federal level, whether it's legislative support, a regulatory response, what would be most helpful in terms of federal relief to help address some of these impacts?
Yeah, I think that if we could get extensions on trainees and fellowships in particular, that would be great because these people, graduates and postdocs, are very concerned about having shortened opportunities for their fellowships and their traineeships. And they are concerned about having the amount of time and oversight and protected time, if you will, that they need to really gain those skills and go out and be independent in research. Same thing with the Career Development Awards. Those awards where you get protected time, where you just focus on your development and getting that exposure and having that mentorship. Those are really important. And folks that are caught up and they're on a trainee or a fellowship award now, it would be great if we could get them extensions. As we all know, they have very limited time that you're eligible to be on those funding mechanisms. And through no fault of their own, I do think it would be beneficial for them to be able to be extended.
It's really helpful. Thank you again for providing these tremendous insights from the front lines of addressing the impacts of the COVID-19 pandemic on a university's research program. Victoria, pivoting to you now, and knowing that you and the public policy team at K&L Gates have been closely tracking the federal response to the pandemic, what have you seen in COVID-19 relief proposals that might be specifically helpful to mitigate the impact of the pandemic on university research programs or some of the types of issues that Robin has outlined today?
That is a great question, Rebecca. And as listeners are aware, throughout the course of this year, Congress has enacted 3 major COVID-19 relief laws aimed at addressing the ongoing impact of the COVID-19 pandemic. And over the past few months, Congress and the administration have been in ongoing discussions about a potential 4th COVID-19 relief package. In May, for example, the House of Representatives passed the Health and Economic Recovery Omnibus Emergency Solutions Act, which is known and referred to as the HEROES Act. And this $3 trillion measure was the starting point for negotiations with the Senate and the administration over the next package. In regard to provisions that may be of interest, the HEROES Act, for example, appropriated nearly $37 billion for institutions of higher education, and it also appropriated over $4.7 billion to the National Institutes of Health to expand COVID-19 research on NIH campus and academic institutions, and to also specifically support the shutdown and some of the startup costs of research laboratories. The Senate, however, has not taken up the HEROES Act as passed by the House or redrafted most recently, and mainly due to disagreements over the scope of the measure and the price tag of the proposal. But in July, Senate Republicans introduced the Health Economic Assistance Liability Protection in Schools Act, which is referred to as the HEALS Act. And this is a more targeted $1 trillion alternative to the HEROES Act. And in regard of provisions of interest, this measure appropriated over $15 billion to the NIH, including $10 billion for research relief. But the Senate has not voted yet on the measure. It has instead considered some more targeted relief measures, but these have not provided any supplemental funding for the NIH or other agencies in this regard. But in the past few months, Congress has specifically examined the impact of the pandemic on university research programs. The House Science-Based and Technology Subcommittee on Research, for example, held a hearing in September about the ongoing impact of the pandemic on university research. And some of the policy proposals discussed included a measure known as the Research Investment to Spark the Economy Act. And this would provide over $26 billion in funding for various federal research agencies, so not only devoted to the NIH. And this funding could be used to enable researchers to complete research projects that have been disrupted, or to extend training or employment to researchers on existing projects. Another targeted measure that has been discussed is the Supporting Early Career Researchers Act. which would create a fellowship program at the National Science Foundation to support early career researchers whose employment opportunities have been impacted by the pandemic. And as Congress and the administration continue discussions over COVID-19 relief, it is possible that some of the proposals in HEROES and HEALS, as well as some of these two more targeted measures, could be further considered.
Thank you, Victoria, for that impressive overview. It's really helpful. I think I'll join Robin in crossing my fingers that some of these measures start to move. In that vein, what do you think we can expect in terms of talks resuming or other proposals being brought forward as we transition to a new administration in the White House and as the congressional picture clarifies following the 2020 election?
That's a great question. And I will say there has been some discussion about the possibility of enacting a full COVID-19 relief package before the end of the year. But the prospects are still unclear. We understand that as of last week, for instance, the administration is stepping back from relief negotiations, which means that it's going to be up to the Senate and the House to resume negotiations. And this is important because Senate Majority Leader Mitch McConnell has taken a more conservative approach to the scope of a potential package than the administration. He has backed up a more highly targeted bill of approximately $500 billion. And with House Democrats insisting on at least $2.2 trillion in relief, it's possible that the difference could delay negotiations. But that said, it is worth noting that passage of a relief package is not possible before the end of the year. It's possible that Democrats may be willing to consider more targeted measures until President-elect Biden is in office to pursue a more comprehensive economic stimulus bill. President-elect Biden has emphasized that containing the pandemic and providing relief are some of his top priorities when he takes office. And with several COVID-19 relief programs set to expire at the end of this year, including emergency leave, unemployment assistance, and the deferral of student loan payments, it's possible that the need to keep addressing the ongoing impact of the pandemic could lead to some compromise. And in regard to relief for university research programs, we expect stakeholders to continue to advocate in the weeks ahead for the inclusion of specific forms of relief, which could build on some of the policy proposals introduced today that we discussed during this call. And whether these proposals get included would likely depend on the scope of any proposed package in the coming weeks.
Thank you, Victoria, for this up-to-date and informed perspective and for all your efforts to continue to track developments in the federal response to the pandemic. And also another hearty thanks to our guest, Robin, for her Frontline's perspective, insights, and leadership on these issues. Thank you as well to our listeners for tuning into this episode of Triage on the specific impacts of COVID-19 on university-based research, as well as the types of federal response the research community can hope for to help mitigate. Our healthcare and FDA practice and public policy and law practice regularly advise clients on research regulatory matters and legislative matters and are able to assist in this regard. Thank you again for listening to this episode of Triage, and please do not hesitate to contact us if you have any questions.
Thanks again for listening to Triage, rapid legal lessons for busy healthcare professionals. New episodes are available for download through iTunes, Google Play, and other podcast applications. By subscribing to Triage, you will receive timely notifications of each new episode. Also, if you have any topics that you would like to hear discussed on Triage, please don't hesitate to email triagesupport@klgates.com. We would love to hear from you.